We're going to do another critique of a plastic surgeon website, what they get right, what they can improve, and ultimately what you can implement on your website to get more consults and better consults. Let's get into it. My name is Frank. I'm the founder of Saga Pixel. I'm going to link in the description to a full playlist on these website teardowns. And I also encourage you to check out the full plastic surgery marketing playlist that I'm also going to link in the description. Today we're looking at Cangello plastic surgery. Now I picked this website because it was ranking on Google for rhinoplasty surgeon NYC. It just happens to be the one that I clicked on. And I'm sure at some point I'll be looking at other plastic surgeons in New York, but this is the first one. As always, we're going to focus on the mobile layout of the website. Let's start off with some of the good stuff that they have going on here. So as soon as you land on the page, the hero section actually focuses on a pretty impressive before and after. You'll find in many cases that the hero section actually focuses on the plastic surgeon, and there may be cases where that makes sense, but if you have great photography, great before and afters, like you see here, you really should be featuring them as front and center as you possibly can. Your before and afters and your testimonials are going to make or break your marketing. I also really like how they put the gallery link right in the menu section, and it stays sticky as you scroll, which is good. Now, one thing I don't love is that phone number really can be easy to miss. I personally would have preferred to have a tap to dial, tap to book a consultation at the bottom, but this probably can work too. So overall, how does this page follow the formula? First, you land on the page, you know exactly where you are, you know that you're in the right place. The second thing that needs to get done is to establish some sort of social proof. I think that the before and afters do that to a certain extent, but I bet you as we scroll down the page, we'll probably find there are other things they could have included and didn't. The way that they're also going about this is calling out the Instagram. I think this is definitely a good call. If you saw my video on Dr. Subio in Philadelphia, I criticized them for not calling out his Instagram, where he has a very strong presence. All right, in this case, they're now getting into telling the story about their service, getting into more before and afters, which is good. Talking about he's a pioneer in rhinoplasty surgery. I don't know, I'm a little skeptical. This is a surgery that's been around for a really long time. I bet there's a lot of other people out there that feel the same. They should be calling this out a little bit earlier, all the places he's been featured. I think they do a really good job of presenting all of the actual results that he's gotten for his patients in the past. Definitely needs kudos for that. Here at the bottom, we have a dump of information and testimonials at the bottom and a contact form that is impossible to read below it. Don't love that. So let's go over a couple of things that I think we could possibly improve with this. To start with, like a little more contrast with the buttons and the phone number. You can't really see it too well when you're scrolling down page. I love the way that they've called out all of the results they've gotten in the past. They did a phenomenal job with it. 4 CTAs, why to choose the doctor, patient stories, patient photos. I get that they're putting this in. There's just a lot here, and people are probably getting decision paralysis. I wouldn't have given people that many options. 2 options. I'd also like an alternative CTA down at the bottom, meaning not everybody's ready for a consultation. Maybe they are ready to follow you on Instagram, but they've already scrolled past it at the beginning. I think I'd like to call that out, maybe get them into some of the other social media profiles. From a design standpoint, I'd also say aesthetically, this is more of a personal preference. I don't love this website. I feel it's kind of dark. Dark works when you're going for mysterious, but with plastic surgery, it's not really something that you want to go for typically. Like you want to go for luxury, elegance, beauty, and my personal view is just that brighter, lighter colors work better when it comes to doing this. I also don't love how varied the contact form is. It's literally the very last thing on the page. And when you're on desktop, there's just a lot of scrolling and a lot of stuff that you need to go past. Actually, I'm seeing now, I didn't even notice this picture of him before. I would have liked to see who he was and possibly tighten up this massive space that we have in the middle on my monitor. On desktop, this is a conversion killer, this hamburger menu. It would be a lot better to have these actually listed across the top. I've seen cases where websites went through a redesign and they implemented these hamburger menus on desktop, and then so their leads go down by 70%. There's a lot of people out there that just don't know how to navigate with the hamburger menu still. Overall, this isn't a bad website. The before and afters are actually phenomenal, I would say, compared to what I typically see in this industry. They did a wonderful job there. And overall, I do think that people come away from this website feeling that this is someone that they can trust.